My name is Ellen Briggs, and I'm going to be informing you on the use of alcohol during pregnancy. The objectives to my presentation are keywords that you should be informed about: why alcohol during pregnancy is dangerous, when alcohol is dangerous during pregnancy, the effects from fetal alcohol syndrome, some statistics, prevention, and a summary at the end. Pregnancy is a physical condition in which woman's body is nurturing a developing embryo of a fetus. Fetal development is a process that transforms a zygote into a newborn. Fetal alcohol spectrum disorder is an umbrella term describing the effects that can occur in an individual whose mother drank alcohol during pregnancy. And the first trimester is the first 3 months of conception. Women should stop drinking as soon as they plan to become pregnant. This is important for fathers to be as well. There is no safe time to drink alcohol during pregnancy. Alcohol can cause problems for the developing baby throughout pregnancy, including before a woman knows she is pregnant. Why is alcohol during pregnancy dangerous? Alcohol can cause several problems, including premature birth, brain damage, and problems with growth and development, fetal alcohol spectrum disorder, birth defects, low birth weight, miscarriages, and stillbirths. Premature birth is when your baby is born before 37 weeks of pregnancy. Prematures may have serious health problems at birth and later in life. Birth defects include heart defects, hearing or vision problems, and can cause problems in overall health and how the body develops. Children with fetal alcohol spectrum disorders may have a range of problems, including intellectual and developmental disabilities. These are problems with how the brain works that can cause a person to have trouble in learning, communication, and physical development. Low birth weight is when a baby is born weighing less than 5 pounds 8 ounces. Miscarriage is when a baby dies in the womb before 20 weeks of pregnancy. And lastly, stillbirth is when the baby dies in the womb after 20 weeks of pregnancy. When is alcohol dangerous? During the first month of pregnancy, the fetal brain is growing at a rate of 100,000 new brain cells a minute. Even a few minutes of alcohol exposure during this critical period can exert a major detrimental effect. Before fertilization, alcohol can damage the ovum or sperm in the mother or father-to-be. Alcohol crosses the placenta freely and is directly toxic. A sudden dose of alcohol can halt the delivery of oxygen through the umbilical cord and slow cell division. It also interferes with placental transport of nutrients to the fetus. What a mother does will affect the baby, so it is important to educate ourselves and educate others to help create a world with healthier and happier babies. Long-term impacts on the child can include low birth weight, having issues with learning, speech, attention span, language, and hyperactivity. Tests have found that females whose mothers were drinking while pregnant are likely to have mental health problems. FAS is a lifelong illness produced by unfortunate growth, unnatural facial characteristics, and a wreckage to the central nervous system. Babies who have FAS have unusual small heads, brains, heart, spine, and other biological defects. The central nervous system wreckage influences intellectual impairments, stalls in the physical improvements, vision, hearing issues, and a collection of behavioral issues. Here is a diagram of fetal alcohol syndrome and how it can affect the baby's facial formalities. According to the CDC, 1 in 10, or 10.2% of women aged 18 to 44 in the United States reports drinking alcohol while pregnant. This is defined as drinking at least one drink of any alcoholic beverage within the past 30 days. 3.1% report binge drinking. This means that about a third of women who consume alcohol during pregnancy engage in binge drinking. Among the percentage of women, alcohol use was the highest among those aged 35 to 44 years at 18.6%, college graduates at 13%, and unmarried women at 12.9%. It is certainly never too late to cut off any alcoholic beverage while pregnant. Cutting back on how much you drink while pregnant will help even if it's the last 3 months. A good idea is making mocktails so you don't miss out on drinking with your friends, but also keeping your baby safe. Below, I've included 23 mocktail recipes for you to enjoy and try out. The summary of my presentation is that no alcohol consumption is safe before becoming pregnant or during pregnancy. Drinking alcohol during pregnancy makes your body more likely to have premature birth, birth defects, and fetal alcohol spectrum disorders. Fetal alcohol spectrum disorders is not curable, but can be prevented. To stop drinking, ask for support and avoid situations in which you could normally consume alcohol.